Good morning. I would like to welcome you to the Alpha Alpha Kappa Research Day. I'm Dr. Joy Kimbrell, and I'm going to do a presentation on just some informal research that I've been doing on resiliency strategies in nurses for this unprecedented year of COVID-19. All right, this has been quite the year, as you all well know. Let's take a look at first what nurses reported to me when I surveyed them on what they've been through this year. They talked about all the multiple unique set of challenges that they faced this year. And recall that unlike many of our friends and family that are not in direct health care, they were not able to work from home. They're on the front lines of things, and they had to serve their patients. And because of that, they were challenged with many stressors. This past 13 months, face it, the world has changed dramatically. It's continuing to change. Fears and anxieties have heightened for all of us. And in the beginning, I saw that nurses felt like they were part of this superhero type of network, and we treated them that way. But as time went on and we all got used to COVID, we stopped treating them as superheroes. And in fact, in some areas of the country, nurses were ridiculed and treated pretty badly. So now they're left feeling unappreciated, overworked, disrespected. So let's talk about some of the things they saw. In the beginning, I got a lot of messages and phone calls about lack of PPE or PPE insecurity. Before the pandemic hit, we were used to using and disposing of PPE, and we were not reusing it. And because of the dramatic rise in cases, we were asked to reuse our PPE, and nurses were real insecure. Is this going to work, or am I going to get this and drag it home to my family? And research was coming in fast and furious from other countries about reusing PPE, and eventually we found out it was safe, but we didn't know that in the beginning. We worried about our own health, of course, those on the front line did, and, of contracting COVID and what that would mean. We didn't know what that meant at that time, or we were scared of dragging it home to our families. We had never, and I've been a nurse 45 years and have never dealt with the numbers of death and dying cases. And, nurses are very compassionate people, and when we lose a patient, a piece of us dies with them. And so we put our heart and soul into caring for them, and it was really hard. Then there was the patient isolation and increased need of support from the nurse. Families couldn't visit, patients were struggling, they were all by themselves. We were their support system, and that played a toll on nurses at the bedside. Then there was the problem with the dying patients, and we had problems with internet connectivity during the dying process, or we just didn't have the resources to FaceTime families in with the dying. And that created quite the stress and agony for us, that this patient either had to die alone or had to die with the nurse as their only support system. Now, because of the numbers of cases, we saw short staffing as cases started to rise and rise and rise. And I feel like in some cases that I heard about, leadership was slow to respond to increasing that staffing needs. And then I will say there was a general demoralizing effect that the news media and social media had on spreading inaccurate and false information. I mean, they were, suddenly everybody has a Facebook degree in medicine or nursing, and they knew it all and would argue you to the death over that. So we're going to focus in the latter part of this presentation on strategies that nurses reported that helped them through this year. All right. Other stressors that have been reported to me as I've surveyed nurses is lack of supplies. I heard of not enough kangaroo pumps, running out of NG tubes, IV tubing. I heard all kinds of things. And, you got to have your supplies to do your thing as a nurse. And so that created a lot of added stress. There was a perceived, in some facilities, lack of management support. I got reports of, well, my nurse manager is a nurse, but yet, and we were drowning, phones ringing, people wanting to check on their families. And my nurse manager never came out of the office and offered to help. So now there were some really good reports of managers helping out, and I'll give you an example of that in a little while, but I got over and over this perceived lack of management support. And I know it was hard on the managers. They were struggling, trying to find the supplies, trying to find the staff, trying to, set up things where we could manage this. So it's a catch-22. Then, as I mentioned earlier, lack of appreciation. The public, I know I live in Williamson County, and there was a group that was bringing in food for the nurses and all that. And then boom, that dried up, it went away. There were people sewing masks for the hospital. But then that after a few months that stopped. And I saw some insulting things said to nurses on social media, and a lot of nurses in other cities heard that nurses got their tires flattened and so forth. So lack of appreciation. Slow response on increasing pay. In the beginning, there were furloughs and, nobody seemed to appreciate that nurses were putting their lives on the line. Now that's changed somewhat, and a lot of nurses are reporting high salaries, but that was a slow response. And it's not universal that nurses have seen their salaries go up. Lack of effort to deal with the staff depression and moral injury. Stress and anxiety are common in unpredictable situations such as this pandemic we've had ourselves in. And, nurses have experienced things like anxiety, irritability, sleep disruption, changes in concentration, but yet there wasn't any kind of effort, concerted effort to help the staff deal with this, or it was slow to happen. I even got reports from some nurses across the country that I talked to that talked about, well, I myself got COVID and had to miss work, but I was written up for missing more than 3 days of work. How ridiculous is that? So there were those things going on. Then, as I mentioned, anxiety, stress, worry, post-traumatic stress disorder, or the more common term now is moral injury. We're going to talk about that a little bit, but we don't need to leave our nurses hanging. We need to help them cope. And unfortunately, I've heard about nurses leaving the bedside pretty much in droves, especially ICU nurses. And that's because we didn't help them adequately. There was a study that I read, and I did extensive literature review of New York healthcare workers, because they were the first kind of hot spot, and that 74% of healthcare workers reported worry about the possibility of transmitting COVID to their family. They were distressed about their families and friends. They were distressed about lack of control. 70% reported feeling lack of control. In the early stages, there was lack of testing availability for them and their patients. Lack of PPE, 68% reported this early on. And nurses and advanced practice providers were significantly more likely than physicians to report having acute stress and depression symptoms. So let's talk a little bit about moral injury. And here are a couple of definitions for you. Moral injury occurs when providers are repeatedly expected in the course of providing care to make choices that transgress their longstanding, deeply held commitment to healing. That was from Doheny in 2001. The moral injury happens because they're frustrated. They can't, there's no solution for them, and they can't provide the care that they feel like their patients deserve and that they were trained for. You know, we as nurses come to work to care and to heal, bottom line. That's why we were called to this profession. But during this COVID season, there has been little help and healing for nurses themselves. You know, there's been news reports that document the unsafe levels of staffing, lack of personal protective equipment, overwhelming numbers of patient deaths, all the things we've been talking about. And nurses have quit. They just can't take it. And, you know, we used to call burnout, but moral injury is a step beyond burnout. I've come back from burnout before, you know, by taking a step back and, you know, getting a certification or attending a continuing ed. But this moral injury is a deep-seated distress. Next, we're going to watch a video about what nurses have been through this year.
Slaughter in ICUs like this one in Phoenix, Arizona. The only people allowed in are our healthcare workers. They're overworked and underpaid. They lose hospital. I wanted to know what it's like for them now, after a year of witnessing so much death. Eager to show us their daily reality, 2 nurses wore cameras so that for the first time we could see the ICU through their eyes.
Unless you're actually in there, you have no idea. Nobody had ever even imagined what goes on in there.
This ICU contains 11 of the hospital's sickest COVID patients. Most of them are in their 40s and 50s, and they are all on death's door. It's an incredibly depressing place. I blurred the patients' faces to protect their privacy, but I also worried that blurring would rob them of their humanity. The family of this patient, the one who was rapidly declining, allowed her face to be shown, and they readily told me about her. Her name is Ana Maria Aragon. She's a school administrator and a 65-year-old grandmother. Sarah Reynolds, the nurse in charge of this ICU, organized a video call with Ana's family to give them a chance to be with her, just in case she didn't make it. You might expect the doctors to be running the show, but it is really the nurses who are providing the vast majority of the care.
Give them back every night. Shave the guy's faces and up the 100,000. It doesn't even register as something gross.
I walk into the room, I say, hey, sounds like you have COVID, and I might order day that nurses come to the hospital? Like, why are you even open? 12-hour plus shifts, isolated in this windowless room. These nurses survive by taking care of each other. And by finding small doses of levity.
Now, and there's all these new young nurses coming out, and I feel like a mom to all of them. Morgan, she's got big aspirations. She wants to snowboard and she's so smart. And Deb's just, she's funny.
I'm just gonna follow you, Ramadan. It's so funny though. Just look at you. You're glowing.
I tease her all the time. I can tell her to do anything and she'll just do it because I think she's scared of me. So
Patients spend most of their time on their stomachs because it makes it easier to breathe. But the nurses have to turn them often to prevent pressure sores. There was one woman in the 50s so critical that this simple procedure risked killing her.
Yeah.
even just turning them on their side, their blood pressure will drop, their oxygen levels will drop.
Let's just disconnect all the wires so that we don't have everything tangled.
Her heart had actually stopped the day before. And so the concern was if it was going to make her heart stop again.
It's on Amber's count.
We're all watching the monitors.
I felt really like, "Ooh, you know, we did it."
Arizona is a notoriously anti-mask state, and it faced a huge post-holiday surge in COVID cases. In January, the month I was there, Arizona had the highest rate of COVID in the world. As a result, ICUs like this one have too many patients and not enough nurses.
Because they're so critical, they need continuous monitoring. Sometimes just one nurse to one patient, but normally we have patients to one nurse. But there definitely are times when we're super stretched. And I've got a
A nurse shortage has plagued hospitals over the past year. To help, traveler nurses have had to fly into hotspots. Others have been forced out of retirement. Especially strained are poorer hospitals like Valleywise, which serves a low-income, predominantly Latino community.
Many of our patients are uninsured. Some of them have Medicaid, which pays something, but unfortunately not enough.
This means they simply can't compete with wealthier hospitals for nurses.
There's a bidding. Average nurse here, give or take, makes about $35 an hour. Other hospitals, a short mile or two away, might pay them $100.
We lost a lot of staff because they took the travel contract. How can you blame them? It's sometimes once in a lifetime opportunity to make a lot of money. Every single day I'm off, I get forward respect. Hey, we desperately need help.
This nursing shortage isn't just about numbers.
this is exhausting. We're just running. We don't have time to restroom.
They have to stop home in online school and I think I should have anything to check on their kids and see how they're doing. My day off, I spend sleeping half the day, they're exhausted and there's nothing to eat here often.
Nurses have been proud to be ranked the most trusted profession in America for nearly 2 decades. But during COVID, many worry they aren't able to uphold the standards that earn them such respect.
Quality of care. Absolutely. That's similar.
Yeah, we're nurses are unique.
Anna had been in the hospital for over a month. Her family told me she was born in Mexico. She came to the States 34 years ago, first working in the fields before eventually landing her dream job in education. She was beloved at her school. Former students often stopped her in town and excited to shout, "Miss Anita." She was very cautious about COVID. She demanded the family always wear a mask and yelled at them to stay home. Yet tragically, she somehow still caught it.
She had been declining over the course of several days. She
Because there's no cure for COVID, the staff can only do so much. Once all the ventilator settings and the medications are maxed out, keeping the patient alive will only do more harm than good. So his family is forced to make a tough decision.
We have offered her, we've done everything that we can, there's nothing more.
She's not expected to make it through the day. The time for Christmas was coaching. But Chris is on the phone and you're gonna hold it till his ear so he can give last rites.
That's all, it's like, oh,
Okay. Here with her there and for you guys, okay?
I'm here, awesome. That's now. Like I helped her with her a lot, and I think humanity has dwindled back to big position. Not a big deal.
Arizona Governor Doug Ducey has advocated for personal responsibility over mask mandates. Even though he was photographed maskless at a gathering, and his son posted a video of a crowded dance party.
Even on the outside, they go, I don't care, I'm not wearing a mask, I'm not getting the vaccine. That's bullshit. The second they come into the hospital, they want to, never do they say, I made a decision, I'm accepting this, don't do anything else.
Half a million people in this country have died from COVID. Many have been ICUs, with nurses, not family members, holding patients' hands.
I always wonder. On my mind when I get home. Right now.
One patient in his late 50s was so critical that he required constant supervision. Each of the breaths looked painful.
There was one day that he was kind of, he would look like better, so he would shake his head and smile, and we set up a video call for him, and it was just the sweetest thing ever. I could hear his little grandson, who was probably like 4 years old or so, and I saw him on the screen too, and he was just jumping up and down, so excited. You're doing it, Grandpa, you're doing it, we love you, look at you, you're better. It just broke my heart, broke my heart. He's one that I don't.
But I'd already been told something Sarah hadn't. The patient's family decided to take him on life support. He wasn't the only patient. When I went back to the hospital, I noticed that the bed of the patient had senior flipped over was empty. I heard Sarah years that she passed away.
What's sad is when I go back.
Or seen someone die. And I didn't know these people, witnessing the deaths left me sleepless, exhausted, and depressed. It's unfathomable to me that these nurses have gone through that every single week, sometimes every single day, for an entire year. I assume the nurses must block out all the deaths to be able to keep going, but they don't. They grieve every single one.
I've always loved being a nurse, but I've always wanted to do. And the last couple months, it's definitely questioned my
And what makes this situation so tragic is that many of these nurses hide their trauma, even isolated and alone.
we're the only ones that know. Really want to know. Feel the same emotions that I want them to know that I carry that burden.
But it is a lot.
I'm mom, I'm strong.
Leadership of the pandemic hasn't come from elected officials or spiritual guides, but from a group that is underpaid, overworked, and considered secondary even in their own workplaces. As so many others have dropped the ball, nurses have worked tirelessly out of the spotlight to save lives, often showing more concern for their patients than for themselves. I worry their trauma will persist long after we reemerge from hibernation. COVID's legacy will include a mass PTSD on a scale not felt since World War II. This burden should not be ignored. I was looking through the window of COVID.
All right, well, that video was powerful, and but I think it is real, and it's very strongly points out what nurses have been through. Let's transition now and start talking about resiliency. Resiliency, I've got two definitions here on the screen. I like the lower one from nurse.com, the ability to meet challenges, persevere through adversity, and remain optimistic about the future. That's what we all want. That's our goal. It's been really hard to do. And I'm going to share with you some strategies that the nurses I surveyed have used this past year to survive and thrive. I love this little meme here. You don't realize how much you have neglected yourself until you make yourself a priority again. And I don't know how far into the pandemic you were when you realized, hey, if I don't do something, this is going to eat me alive. But a lot of nurses went through that. So let me talk to you about what some nurses described that they did. I just went back through my social media account, and I saw that I had said, I worry about the future of the nursing profession. I've never seen this level of moral distress and injury in our profession. And then an article I read, Brown from 2001, said people go to the hospital because they need the care of nurses. Without them, there is no care. But nurses are not infinitely elastic resources. They're people, they're human, many of whom are exhausted, traumatized, barely holding themselves together. It's time we really see and care for them. So once again, I surveyed nurses that I know and got their take on how they've coped this year. And I opened up my survey to physicians that were in my sphere of influence as well. And this one really struck me. Dr. Dykema, who is a retired physician who served in Vietnam when he was really young, he said, you know, I've contributed to the resiliency by talking to my son, an ICU nurse, who's trying to cope with the struggle and loss on his unit. It's been helpful to me to relate my post-Vietnam experience with unrecognized post-traumatic stress disorder to his experience and what he may experience in the future related to his present circumstance. PTSD and healthcare workers and others will be a long-term effect of this pandemic. Recognizing that may help people cope. So true. The first strategy is, let's see, did I skip one? Cultivating that strong support system. Nurse CS said, talking with my emotions with my wife has helped me. Another nurse said, relying on my team at work to process what we have dealt with has been helpful. The second strategy mentioned over and over again was teamwork. SF is a Cumberland University adjunct faculty and area hospital educator. And I loved her words. She said, it's been difficult from the critical care nurse who just lost her 20th something COVID patient to nursing administrators that are working tirelessly to find supplies, equipment, and staff and provide safe care. In my role as the hospital educator, I have been I visited with staff, thanking them for their service, helping them to do anything to assist them, training and scheduling ancillary staff to help them with the ADLs, help them with holding the hands of patients leaving the world, bringing them supplies, to buying pizza to make sure they have food when they get a minute. It's the small things that have helped our staff get through this. Allowing some time off to reset, revisit family and friends, and not just have to deal with pandemic issues has been the best form of resilience we have seen to date. Allowing the collective deep breathing and then move on serves to cleanse and be able to continue taking care of every need. Seeing our staff respond and recover has been a remarkably positive component to my own resilience in this pandemic. So teamwork. Nurse JL said, I found an amazing mentor that I can trust and be open and honest with and not worry about her being judgmental. She gives me encouragement, constructive criticism, and promotes my self-efficacy. I was truly getting burned out at the point in questioning why I ever went into nursing. I felt my compassion for others draining away. She helped me find my passion for nursing again through staff education and has encouraged me to go back to school. I think finding a project I am passionate about that serves a purpose in my role as a nurse was key for me. Finding my purpose again as a nurse that directly serves other nurses and promotes increased quality for our care of our clients. Now I feel more passionate about nursing than I ever have. I also dramatically reduced my social media use and used that scrolling time for intentional, focused self-care time. And you will find that a recurring theme as we go along is self-care. Because if we don't care for ourselves, who else will? Others mentioned remembering our purpose as a nurse. Nurse RR here said, take it one day at a time. Remember, this is what I was called by God to do, and I used a lot of prayer. I found that over and over again, that we had to kind of remind ourselves, why are we doing this? And that flows into the next one, mindset matters. Nurse CD said, I reminded myself that people I know have in the past and present had it worse than I do. We also reviewed our gratitude for being in a good relationship. We did not mind being cooped up together. So she took what she had and was grateful for it. CT said, I remind myself that I'm getting this pandemic done earlier than later in my career. If time remains the same as it has in previous history, we shouldn't be due for another pandemic until my career is over. So for the rest of my career, I won't have it as hard as I do right now. That's a great positive attitude. Then maintaining wholeness, body, mind, and spirit. I heard over and over again. Nurse CD, who is a nurse educator and a area critical care nurse, said, attending to intentional self-care, particularly sleep. I think it is also important to set boundaries on what you can do. Also reach out for contact and support by phone, by Zoom, or whatever method that you have. Prayer and meditation was mentioned by several. This nurse, NF, uses an app called Insight Timer. Adequate sleep, finding a creative outlet, physical movement, and watching comedians on YouTube. We still need to laugh, and she found a way to do that. Other strategies, taking one day at a time, not focusing on the what ifs. I did that a lot in the beginning. I would say to my husband, what if we reach capacity at the hospitals and there's no room for patients and we have to start choosing? You know, that's a what if. And my husband just told me, Joy, everything is going to be all right. So that was kind of our mantra. Everything's going to be all right. Trust. Trying to keep my worries more local and what impacts me and my patients directly and less global. Being a pregnant nurse during the pandemic was not the easiest thing I've ever done, but I was lucky to be supported and provided with all the PPE I needed to ensure I could continue to safely provide care to my rural homebound patients. Next is actually me, and I listed things, even though I haven't been in direct care, I'm in education, and I've been a sounding board and support for many nurses through the pandemic. What I did, I started getting outdoors deliberately every day, even back in the winter when I had to wear multiple layers. I just found the outdoor so peaceful and getting out in nature. And then I added a lot of exercise to my regime daily, many times twice a day. I had to limit myself watching the news. It just brought me down and I couldn't deal being bombarded with, you didn't know what was true and what was false. I refused to engage in political discussions. This political year being coupled with the pandemic year, I think made things a lot worse. People started mixing up politics and a pandemic, and I just couldn't deal. So I just made it my policy. I don't discuss that. Meditation and prayer. I've always been a big prayer, but I've never practiced deliberate meditation. And I had an app, and it was the Peloton app on my phone. And my husband and I both started meditating, and it just calmed the spirit and the mind, and started using breath prayer more deliberately, where you would breathe in a word and then exhale a word, like, you know, God, thank you for this beautiful day. God, thank you for the many gifts, or it can be anything. Just, it's called breath prayer. We also attended church, Bible study in small groups by streaming platforms. We couldn't go out. We take care of my 88-year-old father, so we couldn't risk dragging the virus home to him. So we mostly stayed in, but we were able to remain active with technology, and that really helped a lot. Additional wholeness strategies that that I heard about, LM said, I've learned to do more self-care. Since a lot of my care goes to my patients, I had to start taking care of myself. Another nurse said, I got a therapist. Nothing wrong with that. Focused on my physical health as an outlet, prioritized intentional time with my husband and family on my off time to distract me from whatever happened at work. The bottom line, the time is now to consider all of these things, and that we are all under stress, and it's time to consider our mindset and ensure that we have grit and resilience to thrive in our nursing career, because the research does show that I reviewed, there's a strong association between resilience and a successful career. And feelings of well-being, being satisfied in our career, decreased emotional support, and decreased turnover rate in nursing are other benefits of resilience. And I think healthcare facilities would do well to help nurses be resilient by providing assistance to the nurses at the bedside. I have a ton of references. If you are interested in this topic, just email me and I'll be glad to help you with that. Thank you for attending today. And I do this presentation in honor of all the nurses and all their sacrifices this year. Believe me, I see you, I hear you, and I care about you.